I think it's really important with new national organisations having been created like NHS England and the Trust Development Authority, as well as new responsibilities for organisations like Monitor and the Care Quality Commission, that they have a common view about what high quality care is, and also that they work very closely together with recognising their different roles to make sure that the system as a whole is both ensuring that basic minimum standards of care are met, but also that there are incentives for people to strive towards delivering excellent care. Well, I think the national organisations, the Care Quality Commission and Monitor and TDA are working very closely together, in particular to develop this new single failure regime which is being brought in to ensure that tough action can be taken when organisations fail on quality as well as on financial grounds. I think the big issue is data. Well, we have a lot of data. The critical thing is getting that in a timely way down to the front line, to clinical teams, so that they know how they're doing over time and can make improvements and respond to that information. I think that's critical. The second critical thing is that boards play a role not in just being reassured, but actually challenging and feeling confident in their own understanding of the quality data that's presented to them, to know what questions to ask and what challenges to pose. Well, there are some examples of local areas that have really focused on particular aspects of quality, where they have put in place measurement and are really using that to drive improvement. So, for example, Northumberland really focused on patient experience, and they have developed some innovative ways of both measuring patient experience, but also presenting that to clinical teams and to their boards, and that's really been paying off. There are other hospital organisations that have put a big focus on safety. We could look at Birmingham or Salford. Again, have really gone for having an open approach to measuring and reporting on safety incidents with a big ambition to reduce harm. Well, I think the challenge is delivering quality on all fronts. So reducing harm, improving the patient and user experience, and ensuring that care is clinically effective in line with NICE guidelines. And I think it's very challenging for hospital organisations and other healthcare providers to keep their focus on all of those at the same time. So I think that's the really big challenge. I think QualityWatch potentially provides a really unique resource, a very comprehensive view of the quality of care. It can also hopefully develop some innovative ways of measuring and quality, which potentially organisations could adopt in the future. I also think their deep dives are going to be really important, looking in depth at quality to understand what really could be done to improve quality.